Everyone. This is Karen Wenzel going over Milestone 2 in Nursing 400 to provide some clarity, I hope, for expectations on what each element of the rubric should include, as well as the formatting for your paper. Milestone submission guidelines. This milestone will cover the literature review that you have conducted regarding your evidence-based strategies and projects that you propose for the final presentation. Whenever providing an informative presentation to healthcare executives, it's vital there is evidence-based sources included because, as I have pointed out for many of you, evidence-based sources or literature support, other research studies give your paper points credibility. So what you suggest is supported in the literature, so that validates your proposals. Guidelines for submission: the paper should be 3 to 5 pages long, and I would expect about a 5-page paper because of all the elements that are required in this milestone 2. This doesn't include the cover page or the reference page. APA formatting is to be used for the reference list and all internal citations. I want to give you all a hint. I notice, and I would expect that you're using organizations such as CMS, AHRQ for a lot of your evidence-based information that you're getting. So when you have an organization that is a website and you go to a web page, that organization, like CMS, Center for Medicare and Medicaid Services, is in place of the author. It's like a corporate agency or a federal agency, healthcare agency, and that is in place of the author. And then most have a publishing date, so make sure you include all the information regarding the publishing date. If it has a month, if it has a date for the month, excuse me, please include those so that whoever the reader is, that they can go right to that page and know that they have the right date and that that's where you got the information from. And if it's a publication within the organization, like a fact sheet, a brochure, a blog, then that goes in parentheses after the title of the web page or your document that you utilized, goes parentheses after the title and what kind of sheet is it. I noticed a lot of people were using Joint Commission Sentinel alerts. And that's fine. Just in parentheses, you put Sentinel Alert 52, 50, whatever the number is. But Joint Commission is in the place of the author. And just like I said previously, that's how you format it. That is in your APA manual. You look up corporate authors under the author section for web pages, and then it's in the Geeks Guide as well, the PowerPoint that I sent to a lot of you. At least 3 evidence-based sources are required. Anything above that would be exemplary, and I would expect more than 3 for this paper or project. What we have on this slide is the different elements of the Milestone 2 rubric. What I would like you to do is use these as headings, subheadings in your paper. And this would be a level 1 heading, so it is centered in the middle of the paper and double space, and then start your paragraph regarding each element. So proposal of care, value-based support, data evidence, strategies, strategy defense, change theory, change assessment. This will keep your paper organized and your thoughts organized into that section so that you don't become disorganized as you're trying to talk through it just writing paragraphs. And also for the reader will know, okay, I'm supposed to understand the proposal here, the literature that supports that, the value-based support regarding the literature's research, etc. So it keeps everybody organized and the reader knows what to expect in that particular section. And to do that, this is centered and the first word is capitalized for the subheading. Any questions on how to format that, please give me a call so I can help you. The research element of the rubric, here you're going to summarize the research from evidence-based studies or peer-reviewed sources that led you to believe that your proposal would improve quality delivery of care within the organization. So you're going to go and probably reiterate some of the literature that you provided in Milestone 1. However, in this section, you're going to talk about how that particular source supports your recommendation and your feeling that this needs to be fixed at this particular hospital. For example, if I chose falls at a certain facility because they're above target nationally, I would go out to the literature that talks about how the cost of falls, which many of you did, how it impacts patient safety. I would be looking in those articles about why it supports it, but also what it says, the statistics. This is where statistics become very important in trying to sell your proposal. And when you have literature to support those points, as we talked about before, it gives credibility to what you're talking about or what you're proposing. Value-based support. Summarize the research from evidence-based studies and peer-reviewed sources that led you to believe that your proposal would improve value-based purchasing, reimbursement, or any kind of value reimbursement. So it can be the readmission reduction program, value-based purchasing program, the hack reduction program. It can be other third-party payers as well, like Anthem, Blue Cross Blue Shield, etc., but affecting the finances of the hospital. Many of you did this when you utilized the CMS websites. Just talk about this in more detail. So the research you pulled together here will be about the value-based purchasing and those other programs that we talked about that affect the reimbursement and why it supports what you're saying. So if you chose infections or falls after surgery or complications, summarize why or what studies prove this or what organizational websites or federal websites support that. Just expand on what you talked about in Milestone 1. This element or section of your paper, you're going to talk about the data evidence that supported you choosing this as an improvement project. So what you're going to have to look at is look beyond just, oh, they're not performing well in this area. For example, HAIs. I'll just use the case study as an example. The case study said that they had an increase, a 5% increase in their HAIs. But beyond that, there's really no other information that was given for that particular organization. So for the case study, if you don't have true data, true drill down. What you do have is that they were occurring in the surgical ICU. So the ICU had the highest rate of hospital-acquired infections. So use the literature to guide you on what some of those might be in a trauma complex ICU, and substitute those and kind of talk about generally what those might be. If it's your own hospital and whatever you chose, you're going to have to do a drill down. And I did give that feedback for those of you who chose your hospital, is drill down to the areas, because an overall drop in performance for whatever the indicator or measure might be, you have to drill into that to see the source or the root of the problem as far as the occurrence of those infections or falls or readmissions. What are they coming out of, and drill down into those. So it requires a drill down when you're talking about this particular research and looking at the evidence from the hospital. If you guys have any questions on this, call me, text me, email me on how to perform that or get to really what the root causes are as far as the occurrence of patient safety events or issues in those areas. Strategies, so you want to detail existing interprofessional strategies that could be applied to your initiative and organization. So it's not just you going out and recommending all of these and all of a sudden your strategies and everybody's going to agree. Think about in terms of your project, who would you need to include in the interdisciplinary team, and how would you go about including them? So strategies in defense, defend your recommended strategies in terms of their ability to improve sensitive quality indicators based on relevant, reliable research. So here you're basically defending why you think chlorhexidine would work for decreasing surgical site infections, like chlorhexidine bathing, those kinds of things. And so you go to the literature to find support for that, and you cite maybe a couple of sources and research that's available and been done to that showing positive results. Same with falls for fall strategies. Same with hospital-acquired infections. So you're looking for evidence of support because you're defending why you say this strategy will work, and you have to use the literature to do this. Change theory, you're going to analyze relevant theories of change that informed your proposed initiative and could help with implementation. So this is where I gave feedback to quite a few of you in regards to really knowing the organization's politics and how it works, and the frontline management and the manager that you have to convince or sell your project to. So in order to navigate the politics and the frontline staff and gain buy-in for your project, knowing your culture in your hospital, or gleaning it from the case study, how the facility characteristics were described, what kind of change theory or plan would you implement? And you need to be detailed on this, and I expect more than just Lewin's change theory and the freezing and the unfreezing and refreezing, just walking through the model, but how does it specifically work for the characteristics of your organization that you chose? Change theory here, again, we're talking about, and you're going to think about the change theory in terms of your intended initiative or your proposed project. and to the type of the structure. So this is kind of going on with the previous element for change theory. So if you feel like you want to use Cotter's change theory, which is a well-known theory, that might work better than a Lewin. So here you're going to say why you chose the particular theory for this organization. So why does it fit better? And so you're going to kind of defend why you think it works better. For the organization, one theory over another. And this is the next step. This is the step beyond just, regurgitating the theory itself, but to applying the theory, thinking about the application if you were to do a true performance improvement a true performance improvement project, which this is. We're not going to be actually implementing it, but you're to walk through the steps as if you were truly going to implement change. Because as a practicing quality director, I will tell you, this is something that we are driving down to the frontline nurses in magnet hospitals to basically identify what needs to be changed and carry out, develop plans. So this is really happening out there. Some of you I know from reading your project and discussion board, you're familiar with it. Some of you may not be, but it is happening, and it is what makes a distinction between an ADN graduate and a BSN graduate, because you're elevating your practice. And part of that is being able to identify areas of improvement and implement strategies for improvement, and that's change. So understanding theories that really apply to your culture and environment that you work in is critically important for patient safety and to improve patient outcomes. And again, if you have any questions, please reach out to me. I'm always ready to talk about any kind of project, questions about APA formatting. If you have a source that you just can't figure out or find in your APA manual or on Purdue OWL, please reach out to me and I can help you with that. So give me a call if you need me. Thank you.